Hello, everyone, and welcome to a brand new episode of Say Again with me, Amrita Tripathi. This week, we're in conversation with Dr. Amit Varma, the co founder and managing partner of Quadria Capital. Dr. Varma, thank you so much for joining me on Say Again. It's been quite an era since we did our last Doc Talk. I think Doc Talk was a program we used to do back in the day.
It's always a pleasure speaking with you, so I'm glad we could do this.
I do want to ask you over the course of the next 20 to 30 minutes a little bit about the vision, the mission, what you're building at Quadria. We'll talk about healthcare, the vision for healthcare, not just in India, but South Asia, Southeast Asia, where you're operating. And also towards the back half of the chat, a little bit about your journey as well. So just to kick off, the headlines have been that Quadria recently closed a $1.07 billion fund. That's huge, 10% of the fund from India. You already manage more than $4 billion in assets across 27 portfolio companies, from what I gather, across Southeast Asia as well as South Asia. And you've been called the largest dedicated healthcare private equity player in this region. Can I kick off by asking you a little bit about what was the vision when you set up, how you look at things now, especially where you've reached? And of course, congrats on this fund. It's massive.
Thank you so much. And I guess there's a huge amount of hard work, but also an element of luck that has got us where we have. We began our journey in 2012. I and my partner, Abrar. Abrar comes from a healthcare investment banking background. As you know, I come as a physician, as an operator, and somebody who's run healthcare companies before. So it seemed to be a great marriage of convenience, bringing different skill sets together. I think today we are very proud that we've been able to establish South and Southeast Asia's largest dedicated private equity, and the numbers that you had quoted are correct. But I think what's very important is to just talk about the thesis. This hasn't happened by default. It's actually happened a lot of it by design, where we believe that Asia would become the global center of gravity for healthcare. And this is driven by population demographic trends, is driven by rising incomes. And there is a massive chronic underinvestment by any government in this region. So we barely spend 2% of our GDP on healthcare, which should be in the high single digits. Compared to the US, it's almost 15, 16%. What that means is that 60% of the world's population is going to be living in Asia. And we will also create 60% of the world's patients. And we don't have the infrastructure to cope with it. And kind of COVID exposed all of us that we are never going to be able to do enough. While the numbers seem daunting, about $1 billion here and $4 billion assets under management, in the grand scheme of things, there is still a lot to be done. So yes, we worked hard. We have almost 27 investments in the region. But to our mind, we need to work closely with public infrastructure to actually make a dent in the problems that we have.
That's interesting. And I'll ask you a little bit more about that and your portfolio companies. Just to cite, I think it was BCG that said the healthcare market in APAC is expected to reach $5 trillion by 2030. So that scale you're talking about, it is massive, maybe more than we've noticed before.
Yeah, so just to give you a data point, I mean, in 2025, the US and Europe combined was spending 4.5 trillion US dollars in healthcare. By 2030, Asia will be spending more than that. So just talking about healthcare, it's growing at almost 10 to 15% CAGR year on year. As I mentioned, there's not a single country which has put enough healthcare dollars to work. It's quite clear that healthcare will continue to be an investment bright spot for the multiple years. And I just want to expand on the theme. There is this massive inflection that's taking place, and I'm speaking now as a doctor, of what I used to treat as acute care infections, and now the epidemic in chronic care. What does that mean? Obesity, diabetes, hypertension, kidney, oncology, environmentally related pollution disease. What that means for us in the infrastructure is that if I get diagnosed to be a diabetic today, I am going to be a diabetic for the rest of my life. So now you need to create an entire ecosystem around me of doctors, tests, insulin, testing for the next 40, 50 years. There is never going to be enough money for it. So as we had embarked on our journey, we spoke about the fact that we want to do four fundamental things. We want to improve accessibility in our part of the world. Healthcare should be delivered where you live. Healthcare should be delivered at point of care. It should not need people to travel 500 and 1,000 kilometers to come access healthcare. The second is that we wanted to make people aware that there is preventive healthcare that is on the anvil. Again, as COVID showed us, we will never be able to treat enough patients, which means that you need to now prevent disease. The third component of our strategy was how to make it affordable. 70% of my patients are still paying for healthcare out of pocket. Healthcare, in fact, has become the single largest cause of people going into bankruptcy. It's no longer agriculture. There's enough support systems there. It is healthcare. And finally, just because my patients are paying lower than the best doesn't mean that they should get shitty care, and quality needs to be foremost. So those four principles is something that we've stuck through the many years.
That's so interesting. So many things to unpack from that. But let me start by asking you, in this space, when you look at, there's a lot of talk that's been happening about AI and healthcare. What are some of the interesting innovations you're backing? What's likely to be big going forward? Because you're, of course, well poised to tell us about some trends and maybe what's interesting to you from startups working in this space who might be pitching you tomorrow. Yeah.
So maybe I'll start off talking about AI by being non-kosher. I genuinely believe there's too much hype going around AI, especially in healthcare. The candid answer is AI today in healthcare is an enabler. It is making us more efficient. It is driving down costs, but it has not fundamentally changed and will not change how we deliver and see patients, at least in the near future. And let me give you some live examples of a couple of companies. So we have backed a company called Cure.ai, Qure.ai. It's in the radiology space. It started off as a company which was screening X-rays to pick up tuberculosis. Tuberculosis, as you know, is a massive problem in our part of the world. A lot of radiologists, and there are very few of them, spend a lot of time looking at normal X-rays. The idea behind this was to find a way using AI of being able to screen the 90% X-rays that are going to be normal and only bump up the 10% that the radiologists need to do. From that, they have journeyed ahead and they're looking at lung cancer. So that is a live example of how AI has come into play. We've also backed a company called Visa, which is in the mental health space, and they use chatbots. And as you know, since you're in the space, there is this huge scarcity of psychologists and psychiatrists, and not enough people have the ability to reach out to someone, and that's where Visa plays a role. So they are doing a lot of screening models for the NHS in the UK, and we genuinely do believe that there is a right market for it in Asia because Asians have taken to digitization a lot more than any place else. So as we go along, just to give you examples, AI will get better. It will continue to pick up data that we throw at it. It will refine its models and will slowly come into play. The controversial issue is always going to be the doctors. We do not like to change. We genuinely believe that we are smarter. And that leads to this big issue of, will I let technology tell me how to treat a patient or will I continue to do what I do? But I think there's also a lot of changes in patient behavior. Now a patient shows up with Google Stacks already in place. They're already telling you what they have, how they should be treated, which kind of R&D is taking place where. So I guess fossilized souls like myself need to get smarter about how they want to deal with it. So cut a long story short, AI will continue to improve. In the next 3 to 5 years, you will see AI playing more and more of mainstream role. But if you ask me this question today, it is just making us more efficient and better.
And a bit hyped. I do want to ask you, I'd done a chat with Dr. Soumitra Pathare from the Center for Mental Health Law and Policy, who was very clear that, you also need guardrails. So a lot of what's passing for sort of mental health work using AI is unregulated. So, some of these headlines recently that
Yeah.
people are turning to ChatGPT as their unofficial therapist. How do you feel about guardrails and sort of how fast do regulations need to keep up with tech? And you are talking about, the sort of hype that's surrounding this, which sometimes does mean people take shortcuts, I suppose. What's your
Yeah,
take?
yeah, I guess I'm going to make two controversial points. Number one, um, I have never been a big fan of regulators telling us how to practice medicine. And I genuinely believe that as an industry, we should be mature enough to self-regulate. As soon as we allow regulators to come into your day-to-day lives, it will lead to a lot more of issues about what you can or cannot do. Because a lot of times it's not necessary that the regulators are closer to the ground. Now, in the US, for example, a lot of how we practice medicine is regulated by insurance and it's less regulated by the so called federal regulators, But the doctors themselves, the doctor bodies, do a far superior job of self-regulation of good practice, not to do practice, and striking people off roles. I don't see that in Asia. It's either it's the Wild West where we can do whatever we feel like, or it's a very top-heavy government approach to come and tell you how you can. So I guess what I'm looking for is something in between. We as an industry self-regulate, have some kind of very broad parameters given to us by the government, what's acceptable, what's not. And hopefully that will bring public and private to work with each other, because right now there seems to be a lot of deviation. On the second point, which is most important and links to your previous question on AI, is data. There is no mechanism in India and in Asia by which we upload data for the common good. So all private hospitals hold on to their own data, pharma holds on to its own data. While we are trying to do a lot of stuff, and I'm part of the Ayushman Bharat digital mission, it's just very hard to get data, anonymize it, and then be able to make sense. This has been done by insurance in the West. And I think what is needed here is almost like a morcha, that people come together and say, Guys, garbage in is equal to garbage out. If you really want AI and data to succeed, let's put in good data in so that we can get good outputs. So if we could work together, and this requires everybody coming together, of working on data sanctity, data anonymization, and lack of penalization, and not you cherry picking it to, decide that this guy cannot get insurance. I think that is the need of the hour.
Before I switch gears a bit and ask you a little bit from your perspective, you've worked as a doctor in the US, in India, across the region. Of course, you have a different perspective as well. What is your advice to startup founders? This can be rapid fire, or you can have a nice sort of, profound answer. In the sense that everyone looks at, of course, and you are also looking at deploying capital to scale healthcare businesses. Where do you sit in terms of like idea into impact into scaling? Like what are some tips you would have for founders who might be ready to pitch, who might not be ready to pitch yet?
So a couple of statements to address it, and I think, and this is advice because I get pitched pretty much on a daily basis. It could be a seed, and it could be somebody wanting for us to buy 100% of the company. The good part of how we are structured today is that we have the benefit of writing a $1 million check, and we can write a $250 million check. So basically now Quadria Health Code as a platform can take all comers. I think over the years, the whiplashes on the back have taught the following, and this is my advice to budding entrepreneurs in healthcare specifically. Number one, understand that healthcare is different. It requires deep domain expertise, regulatory knowledge, and a commitment to patient outcomes. If you don't look at all these three, then you are going to don't treat it like any other sector. I think the second is focus on solving real problems rather than creating solutions for perceived problems. A lot of people come to me saying, I think this is a problem and this is the solution to it. And I said, dude, how do you know this is a problem? Where's the data which tells me? He said, no, but my PowerPoint and the macro data by the BCG, Bains and McKinsey tell me that. So there is too much of this window dressing that's going on in creating solutions. I think the unmet needs in healthcare are enormous and obvious. Third is that you build for the long term. Healthcare is long term infrastructure. To my mind, as we as a country have focused on building ports and roads and infra, we should treat healthcare and education as core infrastructure. You put in money today, you will see the results 7 to 10 years down the line. And that is the longer term mindset that people should be approaching this whole vision of how they think their companies will evolve. So don't just do it for marking it up for the next investor. Don't do it to create the perceived value creation. Don't do it because it makes you a unicorn sooner. All of those kind of businesses tend to fail. And the last is what very core to what we do is the impact mission that you deliver through healthcare. At the end of the day, whenever you treat a patient, you're treating a family, you're treating society, you're treating a village, you're treating a city, and that is very, very important. So the whole impact metrics of how you can make it a lot more direct, I think is important. And lastly, tech and innovation is going to be fundamental of how business plans evolve in the next couple of years. And that is something. So These 4 or 5 things, if you could put that into your pitch deck when you come to not just us, but anybody who wants to invest, this should be core to you.
That's interesting. I'm making notes. Any budding entrepreneurs, please make notes. Is there any difference that you've seen? And there must be. I mean, you're working across multiple markets now. I want to ask you a little bit about your experience. You've, of course, worked in the US, but you've invested with your companies India, Indonesia, Singapore, Malaysia, and Vietnam. It looks
Vietnam,
like.
that's right.
Have you found fundamental differences or any similarities you'd like to call out when it comes to healthcare in these markets?
So the reason we stuck, Amrita, to South and Southeast Asia is that we saw a couple of things, regardless of the religion, cuisine, language, which were fundamental to healthcare. And boils down to 3, 4 things. Lack of infrastructure, so not enough beds, not enough manufacturing abilities. Lack of people, skilled manpower, so not enough doctors, nurses, technicians. Lack of technology, so not enough equipment and digitization. And most importantly, lack of affordability. Take Singapore out of the equation, 5 million people. I mean, that's South Delhi for you. So let's not debate that. But just talk about large populations. India, 1.5 billion, Indonesia, 300 million, Vietnam, 150 million, Malaysia, 150 million. It's the same problems. So I guess as you think of healthcare as a problem, we decided that if there are good pilots or good business plans that we can implement, let's say in a Vietnam, and it makes sense to do the same in India, we borrow shamelessly. We take good practices from India and move it across Southeast Asia. What we have done, which is very different from others, we're not trying to create pan-Asian platforms. I'm not trying to build hospitals in India, Indonesia, Vietnam, Malaysia under one brand. What I am trying to do is build the best of healthcare in each individual country. And I think that has been our differentiator. And that has enabled us to not make mistakes of trying to do too many things at the same time.
Yeah, because it sounds like that, that focus on your mission has to be like above all, right? When it comes to all these different regions.
Those 4 principles that are defined,
Yeah.
everything, every time we approve an investment, those are the 4 lenses that we look at.
So when we look at your journey, Dr. Varma, I mean, you specialize in critical care. When I first met you, you were working as an operator also, of course, COO, but critical care was your specialty. And we would do a lot of conversations with you to, I think, mainstream,
Mhm.
some of the information everyone should have. You've always been big on just trying to get knowledge to and resources to people who need it. Can I ask you a little bit about how because this is it's not a pivot, but it is a different ball game altogether, right? So when you moved in a way to set up this fund and work with your partner, and you was it looking at the gaps that you were aware of from practice, or was it something else that drove your journey?
It's a series of incidents of jumping off cliffs without realizing what you're going to end up doing. The first cliff jump was coming back from the US to India back in 1999 before it was sexy to come back. Not knowing what you would end up getting done. The fact that I'm still here means things work. So coming back from the US to Bangalore, working with Devi Shetty for 4 years, learning from him scale, size, and the belief in his mission. He's one of the foremost principal persons that I know and I still admire, who has great admiration for his own ability. The confidence that he brings to the table of whether this can be done or not done, I have learned that from him. Just dream big. The second was realizing that the business of healthcare was changing quickly and doctors need to be part of decision making. And for that, you need fundamentals of business. And that's how the Fortis journey started. I think the third leap of faith was saying, fine, we've gone through 7, 8 years of learning how businesses, not just Fortis, but SRL, Religare Insurance, how do those work? Now, why not, instead of treating a few thousand patients, why don't we become investors so we can treat millions of patients and then thinking across scale and size? So the short answer to your question is that where one is today is a series of accidents, but the ability to risk take and the ability then to pivot and take decisions based on the fact that what you are doing is going to make sense to you or not. But I think at the core, you need to also look back and say, what is it that you're looking for? And I'm not talking about individual businesses. I'm just talking about creating a platform and and what makes you tick. I think as a business leader, there are a couple of things which are fundamental. The first and foremost is always integrity. Integrity of the people that you work with, integrity of the business that you invest in, integrity of all the stakeholders, because uncompromising ethics in all dealings is foremost. The second is empathy, especially in healthcare. I mean, if you're not empathetic, you're in the wrong business. Then you should go back opening restaurants or doing something else interesting. I think the third is resilience. I still haven't come across a business plan which follows the business plan model. So you have to keep pivoting on a yearly basis. I think the fourth would be vision, just having a medium to long term vision of saying, what would this business or what would this field look like 5 to 10 years down the line? And finally, it's all about collaboration. It'd be asinine of me to believe that we could have done it on our own. There are innumerable stakeholders, people, well wishers who've enabled us to get where we are.
I'm too small to get sued. So I'm not going to ask you about some of the controversies, but how important is it to also keep an eye when you talk about integrity and also what I notice on our little startup journey is it's almost as important who you choose not to collaborate with, like as who you choose to collaborate with. How do you look at tough decisions that have to be taken? How do you look at success and failure today that might have changed over the course? I think is it almost 35 years of your career across the board? How would you look at success, failure, and these kind of tough decisions that also come from having that risk appetite you were talking about?
I think, Amrita, a lot of it is being consistent about knowing yourself and believing in what you're doing is right or wrong. I think the second important thing is the ability to pivot and accept that you've made a mistake. It could be a partner mistake, it could be a person mistake, it could be a business mistake. And to be able to turn around and say, yes, my screw up, let's move on. I think owning that responsibility and turning around and not trying to blame others is equally important. So the way I talk to people, and this ranges from my kids to my team, is very simple. If there are going to be 10 decisions that you make, by now, after that 35, 40 years journey, 8 out of 10 times you're going to be right. The ninth time, you are going to be wrong only because your input data wasn't correct or that person had change of hearts of ethics integrity. And the 10th time, please accept the fact that you are going to be wrong regardless of whatever you do. So if you go with the 8-to-2 loss ratio, I think you're okay.
I've never thought of it that way. That's actually very, very pragmatic advice also to anyone who's on this, because you're in it for the long haul. You do have to have that sort of grace also. When you look at what you've been able to achieve over this incredible career, and I completely understand what you're saying about let's impact millions of lives. And of course, I did read somewhere that you're looking at, is it also expanding to the Gulf, to the GCC region?
So I'll explain it. As we found success in South and Southeast Asia, in the current world of geopolitics where the world has gone mad, there is still belief that there are areas of expansion. So there is a very nice India GCC corridor that has evolved, which mainly uses manpower as the fulcrum. So we export the best nurses, doctors, technicians. But more importantly, the GCC is coming to us and saying, guys, you run pretty efficient systems in India at cost models. Till now, we never cared about cost models, but now we care about cost models. So can we learn from each other? And there is a second corridor that's developed between the ASEAN, so the Indonesias, Malaysias of the world, into the GCC. So the businesses are slightly different. So our endeavor is to create a beachhead by starting off with the Dubai office at the end of the year. And we expect about 10 to 15% of our capital to now go into the GCC.
Interesting. Of course, if you ever need a podcaster, you know who to come to, since this is my new avatar as you take over the world. Have you, even though I understand completely, but how you made these pivots and these decisions and the scale and potential for impact is so much more. Do you ever miss practicing as a doctor? Not so much.
Not really, not anymore. I mean, I'm still, and I can proudly say that still the go-to clinical advice for family and friends. So still very proud of being able to do that. I still devote a significant amount of my time weekly in just staying updated. It helps me in two, three ways. One is personal satisfaction. So I know what's going on in the world in the in clinical medicine. I read on a daily. I think the second is the fact that when you're dealing with big name doctors and hospitals and the fact that you can still talk medicine gives me that sense of enablement to be able to actually talk shop with them. And lastly, it's very, very important in our field because it changes very rapidly that you are at the forefront of change. So you don't want to find out by default that guess what, this MRI has now become obsolete. You should know 3 years before that it's heading in that direction. So do I miss seeing a live patient? No. But do I miss not being relevant in clinical medicine? Absolutely. But this is the way I'm projecting myself.
And that must be a huge asset, right? Because you are also evaluating constantly. I mean, from the folks that you work with. Just last few questions for you for the moment, Dr. Varma. These are, you can answer them as you see. If there's something you're looking forward to this year, and I tend to ask people who are working in sort of innovation and tech, if there's anything that keeps you up at night, what's anything that stresses you out? Is there something you're looking forward to, and at the same time something you're worried about in the next couple of years?
So, what I'm looking forward to is the rapid deployment of AI and digitization in healthcare. And I think as a 506 year, or if you actually want to go back to higher weight times, for a few thousand years discipline, we are very poor at adopting change. So I genuinely believe that I hope that AI and digitization fast forwards the way we practice medicine in the next 3 to 5 years. Interestingly, I answered the same question yesterday in a conference that I was speaking at. What keeps you up at night? And it is the stuff that I cannot control. It is geopolitics in a mad world. Somebody decides to launch a nuclear missile. It is the kind of currency risk that we see. Again, it's not dictated by us. And we take money in dollars, we have to return money in dollars. So if the rupee is taking a hit, it affects our businesses. And the third, which has now become much lower, is any kind of regulatory hiccup that some government decides to put into place without usually having that discussion. But as I mentioned, thanks to COVID, it's become few and far in between. Governments have realized that they don't want to mess around with the working ecosystem, and they want to make us private guys part of this decision making. So that has enabled it. So it's very rare that I'll wake up in the morning and read in the newspaper there's a price cap on stents or something like that. It won't happen.
Yeah, which used to happen, right? That's so interesting that COVID was that moment where people woke up to the gaps in the healthcare system. That deserves its own separate conversation, I think. But last one for now is to ask you if there's anything you're grateful for that you'd like to share with our audience.
I think gratitude, clearly, that to be born in the right place at the right time, to be part of the India and Asian system. I think the gratitude was that took the decision of coming back when I did. One could have been a very small fish in a very large pond in the US, successful, made a lot of money, life would have been good, versus now gratitude towards the ability to do a lot of big stuff in a smaller pond and actually make a difference. So as you look back on your professional legacy, you've actually done some good stuff. And I think there's a, if I may say it, there's a certain amount of pride.
That's awesome. Thank you so much, Dr. Varma, for taking the time out and for sharing some of your insight on this very interesting space. I appreciate it.
Thank you so much. Thanks for having me.